Remember above all that seeking help is a sign of strength. It's not a weakness. Understanding the challenges that you're facing and reaching out is you taking a really vital step in moving towards the well-being that you deserve, and that allows you to show up as the parent that you planned on being.
Welcome to the Baby Sleep Connection, a podcast that explores baby sleep and more through the lens of attachment and development. I'm your host, Heather Boyd. I'm a mom of 3, an occupational therapist, and a certified infant and family sleep specialist. If you are a tired parent who wants to support your baby sleep holistically, keep listening as we delve into approaches that go well beyond the usual strategies of wake windows and bedtime routines. Your baby's sleep is connected with so much more.
Welcome back to the Baby Sleep Connection. I'm your host, Heather Boyd. I had the distinct pleasure today of attending Flora's Walk in Niagara. Each May, communities like Niagara across Canada come together for Flora's Walk. Flora's Walk is the nation's largest perinatal mental health fundraiser, which I think is pretty darn significant. This event not only raises funds, but also supports awareness and solidarity and connection among families that are navigating the complexities of new parenthood. Since it started in 2022, Flora's Walk has encouraged and facilitated over 100 organizations to be able to provide accessible support through group programs and therapy for individuals and families who are facing perinatal mental health challenges. Now, as an occupational therapist and mother of 3, I understand the transition into parenthood and how challenging it can be. It's so important to recognize what the range of feelings is when you become a parent, to understand what is normal, and to understand where to seek support when you are struggling. I am, however, not a mental health professional. I'm also not someone with personal experience with perinatal mood and anxiety disorders, or PMADs. And because of this, every year that I participate in Flora's Walk, which is now 3 years in a row, I always second guess myself around how to spread awareness, talk about this through posts and blogs. And so this year, right on the heels of participating in Flora's Walk, I'm diving into this podcast episode, trying not to fumble my words and try to focus primarily on how important this is. Now, PMADs come up a lot in the work I do with families around sleep. As anyone who is tired can appreciate, just the lack of sleep alone has an impact on mental health. For those with PMADs, the intensity of the symptoms and the support and professional guidance that they need gets ratcheted up exponentially. And so rather than simply or solely focus on supporting families privately with my one-on-one, I am using this episode to really bring to light some of the issues that Flora's Walk really highlights. If you want to know where Flora's Walk started, where it all began, I encourage you to go to lifewithababy.com to get the backstory of Flora, an Ontario mom who had experience with perinatal psychosis. It's an intense story, but it's one that highlights just how important identification of PMADs is, and psychosis in particular, and a way of reframing just how valuable support in whatever way a parent needs support, just how important that is. Let's talk a little bit about what PMADs are and some of the symptoms, because I think if more people understood what the symptoms were, whether it is you as a mother or father, whether it is you as a partner or spouse, or whether you are a healthcare professional listening into this podcast and you, like me, are not an actual mental health professional, but you are working with vulnerable families at any stage in their parenting, then I think it's so valuable, because identifying it and spreading awareness about this can give families much better chance of moving from surviving to thriving. So what are some of the common signs of PMADs? Well, and I'll start by saying, what is perinatal? We talk about prenatal, when you're pregnant. We talk about postnatal when you're not. Perinatal is anything through pregnancy and the first year of parenting. Now, I say that knowing that some of these mood and anxiety disorders do emerge later, and it really is, not as clear cut as sometimes we try to make it in an effort to streamline diagnoses or understand what the root cause is. It's valuable to understand that 1 in 5 mothers and 1 in 10 fathers struggle with mental health in the first year postpartum, and fewer than 15% get the help they need. That is really such a shocking statistic for me that, first of all, 20%, and it doesn't surprise me, the 20% that struggle and the 10% of fathers, but fewer than 15% get the help they need. That means that 85% or more than 85% of those with depression or anxiety or other mental health challenges in the first year are really drowning. Identifying what the symptoms are in your partner or spouse or in yourself can really change the game on being able to access support. Because if you're not even reaching out for support, that support is going to be really hard to get. It takes being vulnerable because it takes talking to somebody about just how hard a time that you're going through. I'll also add that Canada itself doesn't have a national perinatal mental health strategy. A strategy would allow a national framework for supporting and identifying PMADs, and it would pave the way for that help that families need so badly. So let's talk about some of the common signs of PMADs. And I think this is a concise and short list. It's not the textbook of all symptoms, but it can be a start. You consider, the work that I do with sleep, we look at screening tools versus assessment, and screening tools tries to capture anyone who may have a particular challenge, and it's useful because we don't want to miss anyone. So take a good listen to this list and think about some of the ways that perhaps you or someone you know may be struggling with this. The first is a persistent sadness or low mood, feeling overwhelmed, hopeless, or unable to enjoy the activities that used to bring you joy. The second is excessive worry or anxiety. If you're feeling constantly on edge, if you're experiencing panic attacks, or if you have intrusive thoughts about your baby's safety. The third is if you're experiencing some changes in sleep or appetite. If you're tossing and turning and you can't sleep, you're not sleeping enough, or you're sleeping too much, or when your baby's finally sleeping, you cannot, or you have significant changes in your appetite, then consider that a flag. The fourth is feelings of guilt or worthlessness. Now, if you believe you're a bad parent or that your baby would be better off without you, this is an intense feeling of guilt or worthlessness. This may be different than what most of us experience, which is feeling like we're not good enough. This is a whole other level. And last, difficulty bonding with your baby. If you're feeling disconnected or you're feeling indifferent towards your baby, that is another flag. I want to say again how difficult it can be to reach out for support, but that you are worth reaching out for support to get the help that you need if you're feeling this way. Parenting is so hard, even without PMADs. And when you feel like you're drowning, when you're lost in sadness or feeling overwhelmed, or you're so anxious that you can't sleep or eat, or you're feeling like things would be better without you, reach out to whoever you can to get the ball rolling for support. Now, what kind of support is helpful as we're navigating maternal mental health? The first is professional counseling. Getting therapy, such as cognitive behavioral therapy, has been shown to be effective. And I know when you're lost in the sea of overwhelm and anxiety, it can feel like it's never going to end. But this is treatable. It gets better, and getting the right help is what helps it get better. Medication might be part of the help that makes this better. An antidepressant or anti-anxiety medication might be prescribed. Talking to your doctor or healthcare professional about that and navigating that is a whole conversation on its own, but know that that's part of the landscape. support groups, and I'm going to mention specifically Postpartum Support International, and they're at postpartum.net. They're an organization that offer weekly sessions for pretty much any category of parent that you could possibly think of. So there's a group that's the right fit for you. Connect with an organization that offers resources and support networks like this. It can make such a difference. Another strategy, and it's one that gets a lot of flack, but I think it's so important, is self-care practices. I know that community care and supporting and nurturing our mothers is so important. It's something that doesn't happen enough, but we also can take the initiative to do what we need to do to feel good. Prioritizing your sleep and rest, looking at how you're fueling your body, moving your body in loving ways that help you feel good are all things that can positively impact your mental health. And as much as that community care and nurturing new mothers is so valuable, I think we can't have a conversation about maternal mental health without also talking about self-care practices. Last, partner or family involvement. This, again, takes some of the initiative from moms, although receptive and observant partners and family that know the symptoms to look for can advocate for and support. However, coming from what you can do if you're in this is open communication. Talk to someone loving who you trust, or a healthcare professional you trust, so that you can get the support you need in a good environment to help with your recovery. Now, a conversation on maternal mental health would not be complete on this podcast if we didn't talk a little bit about the importance of sleep. Now, sleep as a parent can be a challenge at the best of times, but when you have anxiety or mental health issues, it can feel impossible. But it is so intertwined with your wellness, emotionally, mentally, physically, that prioritizing it and at times treating your sleep like an emergency is really important. And I know I've talked on previous episodes about sleep emergencies, about when things are really hitting the fan and you are at the end of your tether. The other strategies that I talked about around seeking professional support, getting medication, connecting with a support group, getting partner or family involvement are important, but the self-care piece is where the sleep piece comes in. Parents who approach me about sleep support for their babies sometimes believe that better sleep can only ever be achieved with sleep training. And I know that for the parents I work with, that leaves them feeling tired already. And then on top of it, feeling defeated and distressed that they're going to have to compromise their priorities around responsive parenting. I want to tell you that some of the very basic strategies around sleep hygiene, like routines, setting up the sleep environment, and the timing of sleep can make a really big difference in how sleep is going for your baby and therefore you. Outsourcing other demands like meal making and laundry so you have fewer things going on in your brain and fewer things that you have to do so that you can prioritize rest and sleep. It might also involve saying no to things that compete with your own sleep or your own rest. This means opting for early bedtime. I know that's not a very popular strategy, but I have yet to have a parent take me up on that strategy and not been feeling much better the next day going to bed early. It doesn't mean it's forever. It just means for now, in this season. And so if you find that you're revenge scrolling, where you're staying up late on screens or scrolling the internet, pause on that to prioritize your well-being. I know it's kind of like the screens or the candy or the coffee that make us feel better in the moment, but it's not supporting overall well-being. There will be a time you can go back to it. But right now, if you can get a 5-hour stretch by going to bed early and taking advantage of the longest stretch that your baby's going to get, and then on top of that, pull in your partner or spouse to cap off that 5-hour stretch, even if it's once or twice a week, to get that 5-hour uninterrupted sleep, it is such a game changer for mental health and for your energy level. I'll reiterate again, specifically within the context of PMADs. In mental health emergencies, like postnatal psychosis, it is literally a trip to the ER level emergency. In a sleep emergency, you're very sleep deprived, but it's not necessarily an ER situation. It's about making your sleep and your wellness paramount and getting the sleep that you need right now. So different kinds of emergencies. And the reason I mention the immediate ER level emergency of psychosis is it can be difficult for parents or support people or spouses to really understand how significant a mental health crisis is when they're in it, because we're all so good at managing through and muddling through and hoping that it'll get a little bit better. But when it comes to that acute mental health emergency, ER is the place to go. When it comes to being chronically sleep deprived because your baby isn't sleeping well, then treating that like a paramount sleep emergency and getting that 5 hours of sleep or going to bed early or prioritizing your rest is important. One of the key messages that I took out of the Postpartum Support International mental health course that I took a number of years ago was about hope. And this was something that really has stuck with me from this course because it can feel so overwhelming and hopeless. And it can feel like it's never going to end. That hope is one of the most important things that parents need to know about, because even in the most desperate of moments, recovery from perinatal and postnatal mental health challenges is possible. That recovery relies on support from others to get through. Parenting is not something we were ever meant to do alone, and certainly getting through a mental health emergency was also not something anybody was meant to go through alone. When it comes to not doing it alone, it's about the support that we get in our community and navigating motherhood. Transitioning into motherhood is a significant life change, and it can be rewarding and it can be challenging, and having a supportive community is vital. So participate in local events like Flora's Walk. I can't tell you, even as a professional who was there as a vendor, not as a parent, how connected I felt with that community. I was seeing colleagues that some of them I only see once a year at Flora's Walk. I was seeing clients and getting to see them in person, even though they were primarily virtual or I haven't seen them for a while. So engage in community events like Flora's Walk. Connect with lifewithababy.com, which provides peer support programs and events. Go to an early on center where you'll be with other parents and your kids can play in a safe and predictable environment. And seek peer support. Talk to other parents who have faced similar challenges and can provide some insight and encouragement. Remember, above all, that seeking help is a sign of strength. It's not a weakness. Understanding the challenges that you're facing and reaching out is you taking a really vital step in moving towards the well-being that you deserve, and that allows you to show up as the parent that you planned on being. I'll finish off by saying again how huge and how sensitive I know that this topic is. In a short podcast episode like this, we're just touching the surface. I did talk to someone today at Flora's Walk about doing a full episode, talking more specifically about mental health. Of course, again, it is a mammoth topic, so she and I are going to talk about ways of narrowing that down a little bit. But I want you to know that if you are struggling, you are worthy of support. Don't talk yourself out of it. Don't wait for it. You deserve it. With or without a national perinatal and postnatal strategy in Canada, the supports are there. If you are a partner or spouse with someone in your household who is struggling, take the baton. Take the baton and run with it, because we can't always count on the person who is drowning to be able to reach for that life-saving ring. So get the ball rolling, reach out to support, set up the doctor's appointment, get on to Postpartum Support International to look for a support group. There are spouse support groups in PSI as well, so it's worth looking into. I know this is a heavy topic, and yet at the same time, when I think about my participation today in Flora's Walk, it just made me so happy So happy that there were all of these amazing people, both vendors and community therapists and supports. There was an OBGYN there sharing her perspectives as a physician. There was a mom that went through postpartum psychosis, sharing her story from over a decade ago as a powerful example of what is possible when you get support. So for those of you who are struggling, please know you are worthy. For those of you who are close to someone who is struggling, know that you can make the decisions that help lay out a positive path for the person you love. That's it for now. We'll end this episode, and I look forward to catching you on the next episode soon. Bye for now.
Thank you for joining me on this episode. I do hope that you found the information and perspectives in this podcast episode helpful to you as you navigate your baby's sleep development. Of course, this podcast provides general information, and it isn't tailored to your family's reality or the specific needs of your baby. If you're concerned about your baby's sleep or health, be sure to reach out to your healthcare provider. If you're feeling exhausted and overwhelmed and you need a place to feel nurtured and reassured, you can find me on Instagram at familysleep.ca. Until next episode, look for the connections that support you and your baby.